Hi, good morning, everyone. Let's just do a quick sound check before we get started. If those of you that are on video, if you could just give me a thumbs up if you can hear me okay.
We're good.
Good to go?
Yes, sir.
All right, thank you so much. Good morning, everybody. Welcome to DECCD's information sharing session for October. Those of you that may not know who I am Chad Allgood. I am one of the co-directors of the Division of Early Childhood Care and Development. And then I'm going to let the other folks on my team introduce themselves really quickly before we get started.
Good morning, Ashley Roper. I am project coordinator with DECCD.
Hi, this is Vicki Lowry. I, alongside Chad, redirect the Division of Early Childhood Care and Development.
Angela Crockett, co-deputy director of the Child Care Payment Program.
Good morning, Laura Dixon. I'm Angela's counterpart, co-deputy director and policy advisor.
Okay. Do we have anybody else from my team? Okay. I think that's everyone from our office. So we'll go ahead and get started. We've got a good bit of information to share with you all this morning. Thank you all for taking your time to join us. Those of you that may not be familiar with our setup for the information sharing sessions, first thing I would ask you to do, if you will please mute yourself, just so we don't get feedback from other people's microphones, and so everyone can hear us clearly when we're sharing information. What we'll do is we're going to spend a few minutes at the beginning of the session. We're going to give some updates, some things that we've got coming down the pipe with the division. We've got a good bit of information to share with you all. And then as we're sharing the information, if you've got questions about what we're sharing, or if you have other questions, just general questions about anything that we're doing here at DECCD, if you will type your questions in the chat box at the second part of the session, we will take those questions, and then the way we do that is Laura or Angela, they will moderate those questions and make sure that we get your questions answered. We do ask that if you have questions specific to your child care program, if they're specific to your certificates or specific to your situation, we do ask that instead of asking those questions during this session, that you either send those emails to the CC Payments at MDHS email address, or you can call our call center with your specific questions. But if you do have more general questions about DECCD, please feel free to enter those in the chat, and we'll get to those here in just a few minutes. All right, so we're going to jump right in here with some of our updates. Like I said, we've got a good bit of information to share with you. The first one is that our market rate survey has been completed, and it was submitted to us by the Social Science Research Center at Mississippi State University. We are looking at our cost modeling for those new rates right now to determine what those new rates are going to be. So stay tuned for that. I don't know, someone wrote on the screen. Is there? I don't know if we can get that off or not. Anyway, so the second thing is we're still working on the closeout of the booster shots, the booster shot grants. We're working diligently with all providers who received a booster shot grant to make sure they're getting the closeout completed. If you have not submitted your closeout for your booster shot, please do so as soon as possible. Also, if someone from our office is contacting you There may also be some folks that are at the resource and referral sites that may be contacting you to help you with that closeout. Please work with them. We definitely need to get those booster shot closeouts finished. So if you have not done that yet, please do so. And also, like I said, if you have people that are contacting you to try to help you with the closeout process, please work with them. So we can get that taken care of. The third thing that I'm going to share with you all is in November, we're going to be sending out the dates to this probably in the next couple of weeks. We're going to be hosting a virtual road show. And this is similar to what we did last November, except last November, we talked more specifically about resource and referral services. This is going to be a discussion about our quality system in Mississippi. We're going to be hosting several, like I said, we were going to do a hit the road and actually do some on-site, some actual road shows across the state where we're actually come out and do face-to-face meetings. However, with the pandemic still going, we decided virtual is probably going to be easier and safer for everyone. So we are going to do a virtual roadshow. We're going to have several meetings. We're going to do some during the day, and we're going to also do some in the evenings. So everyone will have an opportunity to participate in the roadshow meetings. During these sessions, what we're going to be doing is I'm not going to be doing a lot of talking. Nobody else from DECCD is going to be doing a lot of talking. We want to hear from you. We're going to be having a discussion about what quality is in the realm of early childhood education. We want to hear from you about our current quality system, what is working well. And when I say our quality system, I'm really talking about our standard center designation process. Talk about what's working well with that, but then what may not be working so well. What is it that we need to do to improve our quality system as a whole? And we've mentioned several times before that Mississippi is going to be revamping our quality system. And as we do that, we want to make sure that you all have a voice in what that new system is going to look like. And this is just the start of that conversation, you all. We are going to start this roadshow, and we're going to be getting feedback from you at the beginning, but that's not the end. There are going to be more opportunities for you all to be involved in that development as it continues. So like I said, we're going to be releasing the dates for those. We'll probably send out an email, like I said, in the next couple of weeks that'll give the dates for those meetings. There will be Zoom meetings, so very similar to what we're doing, like what we're doing today. But I'm not going to do a lot of talking. We're going to let you all do the talking during these meetings. And with that, I'm going to swap it over to Angela.
Sorry about that, I was on mute. Good afternoon, everyone. We wanted to announce that we will be doing or introducing you guys to a new online change of provider flow that will be coming soon. So stay tuned for that. It's going to be very exciting, where we will be able to get rid of that paper change of provider form and have it something that's online that you will be able to access through your portal. So stay tuned for that. We will have that new change of provider flow coming soon. And the next one. And our next thing that we'll be offering is DECCD will be offering policy trainings to providers on a quarterly basis. These will not be mandatory, but will be available for anyone that's interested in learning about CCPP policies. And more information and a schedule will be coming soon for that. And then the first session will be later this month, and we'll focus on the new change of provider flow. So we just keep you guys prepared for that. One more. Laura, it skipped one. One more. Nope. The policy, well, we'll also have policy trainings for parents that will be coming up as well. And we'll be offering those policy trainings during the evening time so that parents will be able to get more information about our program and learn. There we go. There you go. So we'll be offering information sessions for parents on a quarterly basis as well as the providers. And these will not be mandatory, but will be designed to provide more information to parents around policies and processes related to CCP. And sessions will be offered in the evening. As well as we will also be offering this month, starting this month, the first session will be on the change of provider flow. So that's it for me. I will now turn it over to Chad, Vicki.
Thank you, Angela. Good morning again. This is Laura Dixon. I'll be talking to you guys a little bit about the policy updates that we have for you. We got some great participation through our public hearings and through our online submission form of written comments for the proposed policy manual changes that we had. We were able to get those filed with the Secretary of State's office. And again, as indicated when we launched them, they will be effective November 1st. We were able to incorporate some changes and clarifications to information based on some public comments that we received. And so we, again, really appreciate all of your participation in that process and sharing your thoughts with us. I will, as soon as my portion is wrapped up, I will post the link to that new policy manual for you in the chat box. So you can go and check that out if you are interested. It will be on our website on November 1st for, where it will live and to be able to be accessed at any time. But if anybody wants to get a head start, I will post the link to the Secretary of State's office posting for that here in just a little while in the chat box. So watch the chat box for that in a few minutes. As a reminder, some of the big changes that we were able to make with our policies this year is that child support payments to parents are no longer counted as income. Cooperation with child support enforcement is still required right now, but we are not going to be including the amount received for child support payments in the total calculation of income when we're doing eligibility determination initially or redetermination. And again, these policies will take effect November 1st. We're really excited to be able to waive family co-payments for any family whose income is at or below the federal poverty line. Again, that will start November 1 as well. Notifications to families with their updated co-payment amounts will be going out through our system. And providers will also be notified about the changes. And all of that information is available in the provider portal. As soon as the system is updated, the new co-payment amounts for any families that you have will be reflected there as well. So providers will have a couple of options for accessing those changes to families that are within their program. Again, we will be sending written notification to parents who have been impacted by the change in their co-payment amount. It relieved a lot of co-payments for a lot of our families. So we're really excited about that one. Again, that will start with the month of November. Family income thresholds were updated. We have that document that will be posted on the website as of November 1 as well. But the updates allowed for us to be able to reflect the current state median income. And what it did was it increased the number of families who will now be eligible for the program base of income due to changes in the state median income. So we're excited about those changes as well. Those policies, again, will go into effect November 1st. I know everybody's excited about number 4. Just as a reminder, we will be permanently adopting enrollment-based pay practices starting November 1. Our current temporary coverage of enrollment-based pay will continue. There will be no gap in enrollment-based pay practices for providers. But as of November 1, that will be a part of our permanent policies. And so that will allow for providers to receive those funds as they have been throughout the pandemic, based on the child that is enrolled in your program, rather on their daily attendance in your program. Another bonus that we will be alerting you to later this month is our documents that will be available in Vietnamese and Spanish. We will have our website currently is convertible to any language, but our forms that are housed on our website have been available only in English up to this point. And so all of the forms that parents and providers are required to use, either for redetermination or to make a change or for eligibility, are going to be available in Spanish and Vietnamese, and those will begin to be added to our website later this month. We will be alerting you guys to when those documents are available and how to access those, so that you can share those with anybody that might need to access them.
You want to give me some?
Okay.
Yeah, I want some.
Hi, just a reminder, if everyone could please mute their lines, please. We're getting some feedback from someone. We just want to make sure that we can hear everybody clearly. Thank you.
Thank you, Chad. So that's a wrap for the changes that I had for our programmatic policies here. And so I think Vicki is going to come on and talk a little bit about Child Care Strong.
Thanks, Laura. We update there we go, slide. So I wanted to give everyone an update on where we are with the ARP stabilization grants. We are calling that program Child Care Strong. And as I'm sure many of you are aware, the federal government awarded Mississippi a significant amount of money as part of that ARP legislation, $319,476,474 to be exact. And that's the amount of money in the ARP legislation that has been expressly designated to be paid to eligible child care providers. And so we are in the process now of getting the word out to all eligible providers about these ARP stabilization grants. And under the legislation, that would include all child care providers, those that receive subsidies from us and those who do not. And then we've included a link here to the agency's and the division's webpage that will contain all the information about these Child Care Strong awards. And so we would encourage you to go to this link frequently for updates about where we are with opening applications and communicating updates as we go forward with these grants. So that will be the link that that will give you the most current information about where we are with that. And so right now we are essentially in what we are calling phase 1. I think we're trying to get to this portion of the website right now, but it was just a second there. But that is our agency is required to promote these grants and to advertise those, and we're going to do that for at least a 2-week period where we're making sure that providers who may not routinely be participating in information sharing sessions with our agency would get information about it. So now that we're at that website link, you'll see this is the place that you'll come to have the Child Care Strong Stabilization Grants sticker at the top. And then now you see where we laid out 3 phases for this process. And again, we're now in phase 1, where we are including and promoting information about eligibility, the application process, what's required, the reporting on the use of the funding, and helping providers to determine or evaluate their current operating expenses. And the amount of the grant awards will be based on childcare providers' operating expenses. So that becomes particularly important. Once we get through that phase, phase 2 will include the actual application process for the ARP grants, the award of those grants, and the issuance of funding. And as Chad mentioned earlier, I just want to remind everyone participating today that in order to receive ARP funding, each childcare provider has to be in financial good standing with the agency, and that means that you have to have closed out your booster shot application. And so right now, about half of the childcare providers who receive funding through the CARES booster shots have not closed out those awards, and that will preclude those individual childcare providers from receiving ARP funding until we receive all of their documentation. So I would encourage everyone, as Chad mentioned earlier, when you're getting emails and phone calls from our staff, they're trying to help anybody who has not closed out those booster shots do that. And we want to walk through that process with you and help you gather whatever documentation you need so that you can become in good financial standing and be eligible for the ARP stabilization grant. And then phase 3 of the ARP funding will be that we'll have to go through a similar closeout process for these funds, just like we did with booster shots. And we will include information both on the website and the application about what sorts of documentation you're going to be required to maintain and maybe required to provide, and what kind of monitoring will be done in terms of this funding. And that is because the federal government requires that of us. And so we're trying to be good stewards of the taxpayer dollars and make sure that when we launch this process, we provide you with all the guidance and instruction that you need to make sure that you can stay in compliance and in financial good standing, that you will have the documentation necessary. Last thing anybody wants to happen on anybody involved in this call is that at some point the government comes back to try to recoup funds because we're missing sufficient documentation. So we don't want to go there. So we're going to work really hard to get these CARES booster shots closed out, and then to get everybody fully up to speed on what's going to be required to apply and receive these funds, and then also what will be expected in terms of monitoring those funds. So we ask that you just stay tuned, and as more information becomes available, we will keep putting that information on this particular link.
All right, there was a couple of other things we wanted to share before we get into the questions. We've been getting a lot of questions from you all about you're all reporting to us that you're being contacted by bookkeeping firms who are offering to help you apply for the grants and help you with the documentation of the grant process and everything for. And we've heard that they're saying that they'll do this for a certain percentage of the grant funding that you're receiving. Since we did receive, since we know that many of you are receiving that question, we asked the Office of Child Care directly if this was going to be an allowable expense. We did get a response from Region 4 with the Office of Child Care. And so we included their response verbatim here on this slide. So if you look in the middle section there in quotes, this is the response from Region 4. In response to Mississippi's question below, paying another entity, including a bookkeeping firm, to apply for stabilization subgrants and assist with documentation as part of the grant management is not an allowable use of the subgrant funds. Subgrant funds can only be used for services necessary to maintain or resume child care services. So what that means is these bookkeeping firms that are contacting you all and they're saying, we'll do all these services if you pay us a portion of your award. Y'all, that is not an allowable expense, and you cannot pay these bookkeeping firms to handle the grant process or the bookkeeping part of that process. And so when it comes to documenting the use, of that, then that will not be allowable. Now, we are going to provide application and reporting assistance at no cost to you all. We're going to have a team of technical assistants that are going to be dedicated to helping you all with the application process, and then with the documenting of the expenses and all that. That'll be available to you at no charge. The application is going to be very straightforward. That's one of the things that we've put a lot of time into planning out the application process, so it will not be complicated. It will not be complex. So I really don't anticipate anyone needing the additional, the additional assistance there beyond what we're going to provide. But again, just to make sure that you all are aware, you will not be able to use stabilization grant funds for the purpose of hiring a bookkeeping firm to assist with the grant process. Now, if you already use a bookkeeping firm, like if you use an accountant that helps you with your payroll and stuff like that, that's different. These are bookkeeping firms that are hired specifically for the purpose of helping you with the grants. Just wanted to make sure that we made you all aware of that. The last thing that we wanted to share with you is just to show you the web page, the web link that is available. It's an online resource that has been made available. It has information about the grant. There are a couple of webinars that talk about the different sources, the different categories of how the grant funding can be used, as well as there's some really, really good information there about how to document your use of grant funding for these expenses. If you have not had an opportunity, I do highly recommend that you go to this website when you get an opportunity. Watch these webinars. They are going to be very helpful. And I walked through this page during our last information sharing session. But like I said, we are going to provide training and technical assistance. But if you'll go ahead and go to this website, start reading up on the stabilization grants if you have not already, watch the webinars. The more that you all can, familiarize yourself up front with the stabilization grants and with the allowable uses and the documentation, what that's going to look like, it'll make you all, a lot better prepared when we do launch the applications. And so that was all we had in the way of updates, unless Vicki, Laura, Angela, anything else you all want to include? Okay. Well, if we don't, if we're finished with updates, then we'll go ahead and we'll move into the questions.
Okay, so just as a reminder, the session is being recorded, and I will share the link to the folks that are on the session and to all of our providers once that recording has been finished and sent to me. I will share it out with you guys. So if you missed anything, if you came in a little bit late and feel like you missed some pieces of information, you will be able to go back and review any section of today's session that you're interested in. We have a couple of questions. And, you know, when we were moving through this process today, we had several places where we're referring folks out for additional information. So when I send the link out for this recording, I will include the links that we have referred to in today's session in that email, so that it's easy for everybody to just click on those links in the email and go right to those pages. And I'll share that with you all when I share the link for this recording. Okay, the first question, I'll take it, is can you explain the child support bullet? And so the child support bullet is referring to the new policy change that child support payments made to parents will not be counted as income. And so right now, when a parent makes an application to be determined eligible for child care subsidy or to be redetermined eligible, they indicate to us all of their sources of income so that we can tell how much they're bringing in and figure out how they qualify for the program and what their co-payment amount will be. And so what this policy does is it removes any child support payments that parent might receive from that reporting requirement. So they do not have to report the amount of money that they receive in child support payments to our office any longer for the purposes of eligibility determination. They will still have to be in cooperation with child support enforcement. That policy has not changed. So they will still have to have the open child support case, but we are no longer including any income that parent receives as a child support payment in the calculation of their eligibility or redetermination for eligibility. Okay, the next question is, where can we find the newly implemented CCDF state plan? The only ones on the website are the 19 to 21 and previous versions, not the one in effect beginning October 1. I'll take that one too. We do not have approval from the Office of Child Care on the state plan that we submitted yet. So once we have received that approval, then we will notify folks that it's available and it will be reflected on our website. So as soon as we receive approval, we'll share that final document with you guys so you can access it. Okay, this one is for Vicki or Chad, I guess. Can you give us an idea of the timeline of the phases? So this is about Child Care Strong.
Well, to some extent, it's going to depend. We will be advertising and promoting the Child Care Strong stabilization grants for a minimum of 2 weeks before we open up the application process, and that being phase 1. And our ability to launch phase 1 is in part limited by how long it takes us to close out the CARES booster shot. So we desperately want to shift the resources that are currently being expended on closing out the CARES booster shots to launching the ARP funding. But because we've got to determine who is or is not in good financial standing in terms of the booster shots, we're trying to get that done and give the child care providers, which again are roughly half who receive booster shots, are not currently in financial good standing, an opportunity to get that documentation to us. So when the ARP grants are opened up, they're eligible to apply as well. So we're in the process of doing that, and also training the individuals who are going to provide the technical assistance to y'all as you go through that application process. Should you have questions, should you need some help doing that. So we're in the process of getting that training launched for the trainers, so they in turn can assist you when that happens. And then we're still awaiting some clarification from the federal government about the ARP grants. including what they mean when they say that the applications have to be accepted on a rolling basis. And so we're waiting to get that information from them. So there's several factors that go into it, but as soon as we can, we want to get this money out and we want to make it available to all the child care providers that we know desperately need it. And then we'll work through the other phases. We'll just have to see how the timetables work. We're really hoping that the lessons learned through the CARES booster shots will make us on both sides of this equation more effective with the ARP funding. And so that in particular, phase 3 is not so protracted, doesn't take so long.
Okay, thank you. Next question is, will child care providers still be reimbursed for school-age children who are at their center full-time?
I'll take this one. Yes, we are planning to reimburse childcare providers that cared for children full-time last year. I believe we said beginning, was it March or April, Laura, of last year?
April.
Right, April of last year. I will say when we began preparing to make those payments, we found that there were multiple providers who claimed full-time for those school-age children already. And so we're looking at how we're going to fix that, because we do have to fix that process. That is considered an improper payment. And we need to make sure that we work through that process on how we can correct the ledgers being incorrectly filled out, but again, without making it overly burdensome on you all. So we are planning to continue with providing full-time reimbursement, but we've got to figure out that issue first before we do the full-time reimbursement. But a good many child care providers were reimbursed for full-time for the school age, but we are going to have to correct that problem first.
Okay, thank you, Chad. So next question is, does all that money go to child care providers?
Yes, the $319 million figure, all of that money goes to child care providers.
Next question is, what communication will be used to get the word out about applying for these funds? Will it be sent via email? Will each provider receive notice to apply, etc.? Once that communication is out, will each provider receive a phone call to ensure they have received information about applying? This funding is very important, and they want to make sure that there's a lot of effort to share the information.
We're working with our communications department to make sure the word gets out. It'll go out on the listserv to all child care providers that are registered with the Department of Health. It will be mentioned in our information sharing sessions. It will be on our website. And then additionally, we are looking at ways to advertise in print and radio to ensure that all child care providers in the state have an opportunity to apply for the grant.
Okay, next question is, how will the other funds provided in the Cursive grant be used?
With the Cursive funds, as we've said, we're using the Cursive funds to continue the financial supports that we put in place that we began with CARES funding. We used every single penny of our CARES funding. And so now we're using Cursive funds to continue the enhanced rates, which is the 25% increase in our payouts. We're also using Cursive funds to cover parent co-payments as well, and also for the enrollment-based reimbursement versus attendance-based reimbursement. We're also using the Cursive Funds as we stated in our letter to the Office of Child Care. We're using it for training supports for child care providers, including training support for family child care providers and licensed child care providers. As we continue, we are wanting to make sure that we're using these funds in a way that is responsive to to the needs of child care providers. We want to support you for as long as possible as we continue with this pandemic. We're still not, finished with this pandemic. The Cursive Funds are being used for that purpose. I do also want to point out something else that is important to note is this potential rate increase. The market rate survey showed a significant increase in what child care providers are charging at the 75th percentile. If we do raise our rates, and if we're going to continue that 25% increase in that enhanced rate reimbursement, if we're going to continue that after we raise these rates, we're going to have to use Cursive Funds for that purpose also. And we have to take these things into account as well. So we are using the Cursive Funds as we indicated in our letter to OCC. They're not being used for any other purpose. We're using the money for those 3 financial support pieces that I mentioned. Again, the training for you all, there's some of that as well. And so that's how we're using it right now. But we're also anticipating, like I said, a rate increase. And if we are going to do the rate increase, if we're going to continue to pay the enhanced rate, which will be 25% over our base rate, that is going to substantially raise what we're paying out each month in our with our child care certificates.
Okay. The next question is, who should we contact if help is needed? I'm not sure if we could get some more specifics about help with which particular thing. I'll circle back to that question. Our general helplines are open through CC Payment and our 1-800 number. Those are the 2 best ways to get general help from us. But if there's something more specific, if you'll drop that in the chat box, we can circle back to that.
Laura, before we move on to the next question, I did want to mention too that one of the things that we have been focusing on are making sure that we have systems in place for monitoring these grants. And I mentioned that some before, but we're trying to make sure the federal government is tasked us with being good stewards of taxpayer dollars and making sure that these funds are being used to cover allowable expenses. And earlier we talked about an example of an expense that's not allowed to pay somebody to help you write the ARP grant, particularly not necessary considering we're going to have trainers available to help you with that. But going through and making sure that all those things happen so that we don't have to come back to a child care provider at some point and tell them that we've got to recoup some kind of funding from them. So we want to make sure that we are addressing and meeting the standards that the federal government has set forth about what we've got to do, not only to issue these grants, but to supervise and monitor the use of these grant funds. And then also to make sure that we're providing the supports necessary to you as child care providers to ensure that you know what you can spend this money on, both how to apply for it and then how to use it, and what documentation that you're going to be expected to maintain Because as part of the monitoring of this grants, there may be on-site visits. And at the time of those visits, you would have to produce documents explaining how you spent those funds. And so we just want to make sure all those systems are in place so that we're all set up for success on both sides of this grant process.
Okay, thank you, Vicki. And we did get some clarification on the help question, and the question is, you know, who should they contact if they want help with the application? And so that question, and then there's several other questions that I'm going to not ask specifically. I'm going to sort of place them in a bucket together. So there's a lot of questions. A lot of folks want to know the same information. So Vicki, could you just speak to the information that will be coming as a part of phase one, so that folks know what they can expect, what kind of information they can expect to be receiving during this period that can give them the information to help get them ready for that application?
Sure. I mean, we're wanting to make sure that we explain first and foremost who is eligible for these grants, so that people who are not routinely participating in some of these information sharing sessions with us, but who are eligible under the federal legislation, are aware that they are eligible and can apply. So we want to make sure that we're getting word out about the eligibility process. And then we're also wanting to make sure that everybody understands what the timetable is for and what's required for the application process, and then providing the supports for that. And part of that is going to be helping childcare providers determine what their current and ongoing operational expenses are. So that's how the amount of the grants are going to be determined. I saw that there was a question at some point asking about how many childcare providers are in the state. And I don't know if somebody's trying to do the math, 319 million divided by X, but in the event somebody is trying to do that kind of math, I just want to emphasize that the way these grants will be awarded is based on each individual child care provider's operating expenses. And so unless, as we've talked about in previous information sharing sessions, you know, child care provider decides that they think their expenses exceed what our formula suggests. And so, you know, a larger center would have presumably higher operating expenses and might be awarded more money. A smaller child care provider presumably has less operating expenses, and the award would be smaller. So it's not that each child care provider will receive the exact same amount of money. It's going to be like it was for the CARES booster shot. But if a child care provider is of the opinion that their operating expenses exceed what amount was determined through our formula, which relies on the market rate survey, then you can provide additional documentation to us to make the case that your award grant should be greater. And then we'll just have to look at that child care provider's actual documentation instead of going with the formula.
Okay, thank you, Vicki. And I think maybe it would be good if we could just address one more time. There seems to be a lot of confusion and discussion maybe about booster shot closeout in relation to launching the phase 2 of Childcare Strong, and how those two are related, and is it an all or nothing, or will some providers who have completed it be able to go ahead? You know, there's a lot of those questions in the chat box today.
Okay, so child care providers who have successfully closed out their CARES booster shot, they are eligible. They are considered in good standing and are eligible to receive funding through the ARP stabilization grant. The child care providers who are not in financial good standing, and we have two categories. Some have submitted nothing, no documentation whatsoever. And then we have a second category where we have partial information. We have some documentation, but the documentation does not cover the full amount of the grant. So they have given us documentation about how some of their CARES booster shot was spent, but they have not provided adequate documentation because we don't know that how they spent all of the booster shot funding that they received, and we can't determine whether or not the booster shot funding they received was properly spent on the things that were allowed under that grant. So until we can close those out, our agency is not in a position to award more grant money to someone that we can't demonstrate to the federal government, which we're required to do, has spent that money consistent with what the standards are in the legislation. So we really need the child care providers who have not submitted any documentation, or the child care providers who have been contacted and notified and told that we only have partial documentation. We need those child care providers to close out their booster shots so we can move forward and make them eligible to receive our funding. And, and then for all child care providers, I just want to reiterate that we have been spending a good bit of time putting in place processes to ensure that we have accountability controls related to these grants. We have to demonstrate to the federal government that the money has been spent consistent with the way Congress wanted that money to be spent. And the only way we can do that is if we get the assurances and documentations from you as child care providers. And so that's something that the federal government requires of us. And so we need your help in doing that. And the sooner that we can close out the CARES booster shots, that just means more resources, human resources, we can shift to awarding money under ARP.
Okay, thank you. Another question, this is a new one for us. So if they did not take part in the booster shot, will they still qualify for Child Care Strong?
Yes, provided they are otherwise deemed eligible under the standards in the legislation. But yes, you did not have to receive any funding under CARES, but you just have to be eligible under the ARP legislation.
Thank you. Okay, Chad, I want to throw back over to you and just ask you if you could please revisit the efforts that our office has underway right now to help people close out the booster shot.
Yeah, so we have a team of folks that are dedicating themselves to helping with the closeout of the booster shot. We have also asked the resource and referral sites across the state to assist with this also. Like, so we're trying to work as quick as we can to get it done. Something that I did want to point out, I think there was a question about approval if you have not received if you have not received information on your closeout. Those were sent out, but if you missed it, like if you know you've submitted your closeout, go back to your email. You would have received an email from Ashley Roper or Ann Henson or possibly Princess Hayes. Just check your email for that. If you haven't, if you have not received your closeout, the booster shot, just shoot us an email or call our hotline and just let us know that you've submitted all the closeout. We'll get the message routed to one of our booster shot team members. And sorry, it was Ann Farrell, not Ann Henson. Too many Anns in my life. So if you have an email from Ashley Roper, Ann Farrell, or Princess Hayes, they were sending out the closeout email information. Like I said, they're working on that. They may contact you. Someone from your local resource and referral site may contact you as well to offer you some help. I don't know, Laura, is there anything else that I need to expand on with that?
think we just want to let folks know that we do have people reaching out to offer assistance, reaching out through phone calls, and that it, that is a great way to make sure that you have all your ducks in a row, so that you don't have to wonder if you've gotten your process complete. So we just want to encourage you to take advantage of those folks that are reaching out to you all through phone calls and emails, and let them help you because they want to make sure that you can be successful in your closeout process. So I want to just also say that the information, largely can come out of CC notices around this issue. So, you have a couple of points of contact here at the office, but CC notices is probably going to be your primary one. But my recommendation is if you did not receive your closeout information approval, if you did not receive any indication from our office that we have reviewed your closeout information and that no further action is needed, then please just send CC payment an email. CC payment an email, and they can respond out to you for that. So we are actually at 12 o'clock. We are at time. So I didn't know if you wanted to go ahead and close out. I know we have another meeting that we're all on at 12. So I just want to let you know we are at time.
Yeah, we'll go ahead and close out. Any questions that we did not get to, we will answer those and have those posted on the website. Just looking at the chat, I know there's a lot of, I'm seeing, there is frustration there. We understand that getting these funds out is extremely important, but we also understand that we have to make sure that we have proper processes in place so that we're not only accounting for this funding properly, but that we're also making sure that we help you all account for this funding as well. So like Vicki said, a few months from now, we don't have to come back, and if the money was misspent, that we have to recoup it, because that truly would be devastating. We are working diligently to get these, to get the Child Care Strong grants out there. We know that we're asking you, to be patient and to sit tight. We do appreciate, you all sticking, being patient. We're working as quickly as we can to get these out to you. So I do know that this is a very trying time. I do appreciate, as well as everyone on our team, we do appreciate you all in the work that you're doing. So much. Diligently means we're every available person that is available to work on these grants is working on it. This is at the forefront of our priority list. Diligently means that we are placing as much effort as we can. We have other things that we have to attend to, but we're putting every available resource behind getting these stabilization grants, these Child Care Strong grants out. That's what diligently means. And when we say diligently, and that's what we're doing. We're actively working as quickly as we can, following the proper procedures to get the Child Care Strong grants ready to launch. But with that, we are at time. If you want to put your question in the chat box really quickly, we'll add those, we'll address those questions, and we'll have those posted as quickly as we can. Thank you all for taking the time to join us today. Y'all please take care, stay safe. We'll see you all next month.